Hello, thank you for choosing Orthopedic Center of Illinois for your surgical needs. Please watch this informational video regarding your upcoming surgery. We will discuss preoperative education, what to expect the day of surgery, and postoperative education. Preparing for surgery. 3 to 4 weeks prior to surgery, schedule an appointment with your primary care provider for labs and a physical. If you have a cardiologist, schedule an appointment for surgical clearance. If you take blood thinners, please make sure to discuss this medication with your physician, as some need held prior to surgery. It is always best that you quit using nicotine products for improved healing, and make sure you're eating a healthy diet for adequate healing. 1 to 2 weeks before surgery, complete your nasal swab for MRSA. Please note this is only valid 4 to 14 days prior to surgery. You may receive a call from pre-admissions at the facility. If they have all of your required information, there is a chance they will not call. Stop taking certain medications prior to surgery. This should be discussed with your primary care physician. Medications that are to be stopped are vitamins and those listed on this slide, such as Ozempic, Wegovy, Trulicity, Mounjaro. Those need held 1 week prior to surgery. Ribelsis, Victoza, Saxenda, Byetta, those are to be held the day of surgery. It's advisable that you have no manicures or pedicures prior to surgery to prevent infection. And it's best that you prepare your home for your return. During surgery preparation, you will be scheduled for 1 visit with a physical therapist. This will cover exercise training, getting in and out of bed and a chair, showering, and other activities during recovery. Bring any unanswered questions to that visit, as the physical therapist will help answer those. Prehab is required within 12 months of surgery. If you had your other shoulder replaced in the last 12 months, you are not required to take prehab again. Injury and complication prevention prior to surgery. It's best practice to keep your body and your upper extremity free of any cuts and scrapes. Stop shaving your underarm 3 to 7 days prior to surgery to prevent cuts. Again, no manicures or pedicures prior to surgery. Please keep pets from scratching your surgical arm. Avoid any injury to limbs while working outside. And if you have any cuts or open sores, contact our office immediately. Preparing your home. Remove obstacles like small rugs, furniture, etc. Move items you may need to counter height for easier access. Freeze your ice packs so they're ready and available when you return home. Have your medications ready for your return home. And gather pillows to use for elevation and sleeping. Packing for surgery. Make sure you bring your photo ID, insurance card, a current list of your medications and the last time you took them. Living will and power of attorney are optional. Comfortable clothes. It's best to bring a button-up shirt after your shoulder surgery for easier dressing. Walking shoes, and your CPAP or BiPAP if you have one. The night before surgery, you will drink 20 ounces of Gatorade, either clear or yellow. If you're diabetic, you'll use Gatorade Zero. You are provided 1 pack of antimicrobial soap, or 2 packs. You will use 1 pack the night before surgery, washing chest, arms, back, and legs. Let the soap absorb into your skin for a couple minutes and then rinse it off. After your shower, you're recommended to wear fresh pajamas. Do not eat or drink anything after midnight except for the Gatorade. Get some rest and pack your items. The morning of surgery, you will drink 12 ounces of Gatorade. Finish that 2 hours prior to your arrival time to the facility. You will shower with your additional packet of soap, same guidelines, chest, arms, back, and legs. Take medications as directed with a sip of water. And arrive at least 2 hours prior to your surgical time at check-in at the designated area. At the Orthopedic Surgery Center of Illinois, you will use the west entrance and check in on the second floor. At HSHS St. John's Hospital, you will enter through the pavilion and check-in is on the second floor. At Springfield Memorial Hospital, you will use the main door, and to the left, there is a desk that says Surgery Check-in Services. At Jacksonville Memorial Hospital, you will use the main door. Upon arrival to the facility, anesthesia will see you. They will discuss risk, benefits, alternatives regarding anesthesia. If you've had issues with anesthesia in the past, please let them know. For shoulder replacements, they use general anesthesia, which is a combination of medications that put you to sleep in a sleep-like state prior to surgery. This can cause grogginess, nausea, and slower wake-up. In addition to general anesthesia, you will receive a nerve block. This involves numbing the specific area of the body and helps reduce post-operative pain for several hours after surgery. When you return home, plan to have a caregiver for the first 24 hours. Arrange for help with household chores, grocery shopping, and meals. Make arrangements for your pets. You will also be provided a sling at the facility and you'll need to wear that at all times, removing it 4 times a day for elbow exercises. You consider sleep in a recliner, whatever is more beneficial for your recovery. Move around your home every hour during the day. Rest is important. Rest helps with pain, swelling, and too much activity can cause increased pain and swelling. Apply ice or other cold therapy to reduce swelling and pain in 30-minute intervals. Nutrition. Eat as healthy as possible. Fruits, vegetables, protein, whole grains, low-fat dairy. Build up your iron levels and drink plenty of fluids. Use pain medication as directed. Do not use additional Tylenol while taking pain meds. Use a stool softener like Colace while taking pain medication to prevent any constipation. Use a laxative if needed. Milk of magnesia, Miralax, or a Fleet's enema are common laxatives. Do not set alarms for pain medication when resting. Take medication once you awaken. Rest is important, and if you're able to rest, the pain is at bay. Injury and complication prevention after surgery. 2 risks associated with surgery are a DVT and a pulmonary embolism. A DVT is a blood clot in your arm or leg, and you'll notice increased swelling in your thigh, calf, foot, arm, pain and/or excessive tenderness. If you experience any of the above, please contact our office to discuss. Prevention of a DVT is being active and using blood thinners as directed. Reposition often. A pulmonary embolism is the signs are new, sudden onset of chest pain and/or shortness of breath, unexplained anxiety. If you experience any of these symptoms, please go to the nearest emergency room. Again, prevention is being active, using blood thinners, and repositioning. Signs of infection: increased redness, heat or swelling around the incision, persistent fever greater than 101, chills, foul drainage from the incision, and increasing incisional pain. Use proper hand hygiene to prevent infection. Ask others touching your surgical site to do the same. Do not soak your incision. Be cautious and ask for help to prevent falls. Pain medications can cause dizziness, so sit on the edge of your seat before standing and walking, and remove obstacles from your home. You'll be scheduled for follow-up appointments with your surgeon. You may see the nurse practitioner or the physician assistant during your first visit, and x-rays may be taken. We are here for questions. Please call us with any questions at our main line, 547-9100. We do have a provider on call after 5 p.m., so if you do have questions, please do not hesitate to contact our office first. Before you decide if urgent care or the emergency department is needed, please contact our office and our on-call provider will guide you.